I'm not going to be talking about things that are totally new to any of you because you're all involved in healthcare. But the issue of innovation is a real problem in Canada, and we see this at the federal level, we see it provincially, and actually we see that there is a profound lack of shared learning to such an extent that you can see, for example, if you followed the scandalous breast cancer diagnosis problem. It's gone from province to province, and each time they haven't learned from the previous province that had exactly the same scandal. And that perhaps is an example of how learning does not translate effectively between our provinces in Canada, and there's nobody at the federal level that's really trying to disseminate the learning. It's also been said that Canada has the most pilot projects and the fewest scale-ups. So everybody's piloting stuff and nothing ever really changes. These curves probably are not new to anybody here. Like we've talked until very recently about how, years like 2050, like 100% of the budget is going to be spent on healthcare. But the good news is that we are starting to see these curves actually bend. And so many provinces had flat spending in healthcare. Now, coming from industry, you might say, well, that's not a good thing. We'd like it to continue to grow. But believe me, there's lots of opportunity within the $210 billion that we spend in healthcare, so it's not a crisis. But I think for sustainability, that's a good thing. And I think to the extent that we can play a role in continuing this sort of sober look at health spending is a good thing. Now, on a global scale, and this is the Commonwealth Fund, is one of the groups that reviews how Canada is doing, we seem to be slipping. And our friend Jeffrey Simpson has been making a career out of talking about how we're paying for a Cadillac and getting a Chevy. It's really true. The spending in Canada approaches the highest levels of countries internationally, but our outcomes are definitely mediocre in the middle of the pack. So we're spending too much to get the outcomes that we're getting. People are looking more and more now at the provincial level and at the hospital level. There's really a lot more transparency that's coming, and people aren't necessarily liking how they're being scored, and so maybe that's good because that produces the impetus for changes. And interestingly, our taxpayers have historically, they thought, well, we're not spending enough on healthcare, and that attitude is clearly changing now, where there's an appreciation by the public that healthcare is inefficient. And so I think that also is a key vector for change. And this slide, we're from the medical devices industry, we sometimes a little apologetic. Politicians are always saying, the costs of technology are escalating, and yes, they are. But at 3% of the budget, is that really the issue? If you could just click, there's another. You see, really, we think the issue is in the green. And by many people's opinions, maybe half of what's in green is waste, which that's a really interesting thought, is that we could reduce the green dramatically. The green really is the services and the infrastructure that could be more effectively deployed to either improve outcomes or reduce costs. So, I really do believe that Canada is a great place to do business, even in healthcare. As we know, we're financially stable. We've got great academic health sciences centers like Edmonton across the country, and we're certainly leaders in research and evidence. Next slide. The market for medical devices, as I said, it's not one of the larger ones in the world, but it is a $6 billion market. Although it's very concentrated actually, because the very high cost things, not surprisingly, are consumed by tertiary quaternary care in the large academic centers. And we find, for example, at Medtronic, about 80% of our business is in academic health institutions. I'm not sure That's true for all of the people in our industry, but it just shows you how concentrated it is. We have about 35,000 employees in Canada in the sector, so that's not huge, but it's big and growing. And the good news is that perhaps more of the employees in the industry are in venture phase companies. So they're really the ones that are innovating in the technology and growing the market. Yes?
Do you consider medical devices to include EMRs?
Well, that's very interesting. It's not measured in this, but Health Canada does, and we do because of convergence. So these do not include the IT, health IT sector, no. Okay. Now, because we are a highly regulated industry, you really do need to be patient, and that's tricky when you're in the startup phase, because it can take a lot of time to achieve regulatory hurdles, to achieve the HTAs that increasingly we're facing for new categories of products. And also procurement is getting big and challenging to deal with. And their preference is to deal with large suppliers for the long term. And that is also excluding our innovative startup companies. So that's a big challenge that we have. You know, I think I may have covered most of these points. It's just that there's a shift that's going on that's focusing on getting patients out of the hospital, managing them at home or in the community. You know, there seems to be more of an interest in improving efficiency, improving the patient experience, and definitely the public increasingly wants to say something about healthcare and how it's managed. So the opportunity, we have a great workforce of knowledge workers. We have an appetite for change, and it will be very important how we collaborate and work together between different companies and different sectors involved in healthcare. Now, Alberta, I think, and I've watched over my career how you've invested in bringing the best and the brightest to Alberta through your Alberta Heritage Scholar Program and other programs. So you're doing great research here. So it's just a matter of how do you translate that into economic development, and that's where you could be challenged that more needs to occur. And it's not just true in Alberta, it's really true in every Canadian setting. So what are the things we can do in collaboration? Go to the next. So I'm here really wearing a couple of hats. I work for Medtronic, of course, but I'm also involved with MEDIC, which is our National Medical Device Association. And not to get into it in huge detail, some of the things that we're focusing on to represent the medical device industry in Canada include thought leadership, working with procurement, demonstrating value. But the area I'd like to talk a little more about is supporting Canadian innovation, because we all recognize that the source of new ideas and new technologies increasingly comes from the startup sector. And it's also the source of economic development and new jobs. So it's a very critical sector. So I've been asked by MEDIC to lead this particular area, and so our focus is going to be on connecting the venture phase companies with the multinationals so that we can support them with best practice education, understanding the regulatory reimbursement environment, the procurement environment, but also help make connections, because it's connections that lead to economic progress for a venture phase company. At Medtronic, we do have some experience, and some of our colleagues also as well in Canada, with actually merging with a startup company. For us, it was CryoCath, and I don't know if you're familiar, but CryoCath is an atrial fibrillation company, atrial fibrillation ablation products based in Montreal. And they developed a very unique approach to ablation of atrial fibrillation, which actually changes the whole model of how medical treatment is done. But in any case, this company was formed really out of the Montreal Heart Institute. Medtronic acquired them for $400 million. And then the challenge was, how do we retain that in Canada? Because there are many forces, to get you to move. The fiscal environment is not the same in Canada as it is in places like Ireland and Puerto Rico. The presence of parts suppliers is not the same, so that can sometimes be a gap. And then there's the issue of talent. And while we have many talented physicians and engineers, not many of them have spent their career making medical devices. So there is a talent gap in that specific area. So those things all have to be addressed. The other thing that's challenging, for a company like Cryocath was getting the product used in Canada. And interestingly, most of their market development was in Europe. So when we bought them, they actually were doing very little in Canada because of the challenges, regulatory, reimbursement, procurement, this sort of thing. For a small company, you're going to put your emphasis where the biggest bang for the buck is. Europe happens to be less regulated and obviously a much larger market, so it's logical that you would go there. But we've been working with a number of groups, including many of you in this room, to try and get this area of access to new innovation addressed. And it's going to take some effort. We're getting some breakthroughs, but progress has been slow. But I can tell you the governments of Quebec, Ontario, BC, and Alberta, in particular those four, are very interested in how can we create opportunities for young Canadian companies to get part of the $200 billion spend that's going on in healthcare. Another very interesting model, which I like to talk about in Alberta because I think it fits with your thinking in Alberta, is this thing called Excite. And Excite was formed out of the Mars Group and the Ontario Health Technology Assessment Group in Toronto. But it's an opportunity really to take a pre-market product and not just do clinical research on it, but do the whole gamut of what's required, the health technology assessment, human factors, and really understand how the knowledge could be translated so a product could be successful. So that's just one example, of how, and there are many, while we are participating as a multinational, out of the first 2 rounds of Excite, there's 2 multinationals and 11 Ontario-based startup companies. So it really is having the goal of accelerating access to the market for small companies, with the larger companies maybe paying some of the freight in the way that the cost structure works. Just in the area of product innovation, I probably don't have to tell you what's going on, but some of the examples of things that we're interested in and working with scientists on is convergence. And here you see, our background is in the physical sciences, really material sciences, microelectronics, these sorts of things. But increasingly, our devices are also storing information which can be used to diagnose and manage patients. And of course, there's the biological dimension. Many of our products are coated with biologics. They may elute or actually infuse biologic agents into the brain or the spine or other organs. So that's really what's going on the technology front. And the goal is really to address all of these things: length of stay, expedited diagnosis, remote management of patients, and being able to manage chronic disease in the community. Also, I'm sure many of you are familiar with these kinds of trends, that more and more we want the therapy to be very patient-specific and site-specific. We want it to be less invasive, and we want it to be reduced in complexity so that patients understand it and it can be used easily and reproducibly. One example, and I just picked this one because Alberta recently made a decision to fund insulin delivery pumps, which is an area that we're involved in. And just to show you that it started with infusing insulin, but now it's including direct subcutaneous blood sugar measurement and the ability to integrate in a loop. We're getting closer to a closed loop so that the pump can actually adjust to the patient's physiologic state. And then the third thing is that we have a platform which we call CareLink, which allows the data from this pump to be both compiled for the patient so they can analyze their 24/7 blood glucose, but also it can be transmitted to healthcare workers who want to see how their patients are doing at managing their blood sugar. In order to do this, though, increasingly, a device company can't do this alone. You need to have network partners so that you can both transmit and assemble the data. So increasingly, we're working across the spectrum of companies in the IT telecom continuum. And this is a great example from Alberta. I'm not sure how many of you know Ann Colburn, who's based in Edmonton. But a couple of years ago, Ann Colburn was based in St. John's, Newfoundland, and she was following about 250 patients with insulin pumps, type 1 diabetics. When she moved to Edmonton, there was no immediate solution. She could not find another endocrinologist to pick up her practice. So she decided she'd keep her practice and manage her patients from Edmonton. So for a couple of years, she remotely tracked, and she would go back to St. John's once or twice a year, see the patients face to face. But she was able to do that, again, with a remote technology. So that's just one example. Another example in the cardiac arrhythmia field, and again, Alberta's making progress in this area recently, which it shows that you can monitor and manage pacemaker and defibrillator patients at home. And we're looking now at opportunities really to expand this beyond purely the device patients so that you could manage populations of heart failure patients, diabetes patients, any patient that has a chronic condition with easily measurable physiologic variables. And then the third area of interest is optimization. And I'm not sure if many of you would have seen the Ernst & Young report that was published at AdvaMed in Washington this year. But it's really tracking how our industry is changing and how the focus, while we continue to come out with exciting and innovative new product technologies, we're starting to focus more on the whole continuum of care and how we can make it more efficient and also make it resident more in the community and the home. And I thought this was a great example from Nova Scotia. I think some of this is being applied in Alberta, but the idea that paramedics have a lot of downtime, and there are a lot of patients in rural communities who don't have medical care. And so what's happening in Nova Scotia, and I think it's happening in Alberta as well, if I'm not mistaken, the paramedics are providing basic medical services in the community. So it's filling a very important gap. So that would be a model innovation. This is our CEO, Omar Ishrak, who we're very fortunate to have had join us a couple of years ago from GE Medical. And he's really charged us with this focus of how can we address the sustainability of healthcare by focusing on better economic value. And that includes not only the cost of products, but also the cost of running clinical programs and the cost of managing patients, which could be at home, as I said. So we're really focusing on these things as a company. We continue to focus on improving outcomes with medical technology. We've always done that. That's nothing new. But we're focusing more on optimizing cost and efficiencies. And so we're going into hospitals across the world and offering to work with them to re-engineer their clinical pathway for patients and find ways of eliminating inefficiency and waste. We also are very concerned about access. So something we see, it's perhaps very true in the medical device space more so than many others. We find many of the products that we manufacture are achieving between 5 and 15% of standard of care in the Canadian market. So they're very underutilized, and which is a problem when their outcomes can be superior to the alternative. So that's an area we're very focused on. So we've developed a new model in our company, which we call Hospital Solutions. And it's a team, and our team in Canada is very new and very young. It's headed by Mike Emery from Western Canada. And his job is to work with hospitals and health systems to develop innovative solutions to create efficiencies, reduce costs, and improve access and outcomes, which is a very big objective. I'm sure you agree. Now, I would state that that's only in the areas, though, where we have clinical expertise. So we wouldn't be involved. Don't worry, we're not in renal disease, and we're not in cancer, and we're not in many, but we are in cardiac services, we are in neurosciences, and we are in diabetes. So some of the things that we focus on is the productivity of clinics and operating rooms, the management of wait times, achieving standard of care benchmarks, and also looking at staff as well as patient satisfaction. Yes, go ahead, Mike.
Just picking up, talking to a few startups here at the break at lunch, and they all experience the same thing on innovation. It could be anything from as simple as a trauma closure clip, really advanced, neat product, to bio films and coatings. It's the connecting the dots between that technology and how it reduces infection rates, or how does it reduce length of stay. And one of the challenges in the healthcare system for any technology is that there's these silo budget buckets, and if you can reduce a surgical OR time or reduce an ER visit where the cost might be borne a small premium cost, even though the costs are offset in reduced ER visits or long-term implications of care costs, it's very difficult to connect those dots in the healthcare system. So that's where we see part of these things that Alberta is doing through the different bodies to try to connect those dots between these disparate silo budgets.
Yeah, we find, it may sound crazy, but there's a lack of common currency. And you think, well, it's all in dollars, but it's not. It's his budget and her budget and their budget, and the dollars don't translate. And with innovations, it's very uncommon that the cost of an innovation is incurred in the same clinical part of the service as the savings. So the costs are not translated. These are just some examples of some programs that we've worked with. Maybe we'll just move ahead. So this is a slide that I like to read. So every morning in Africa, a gazelle wakes up. It knows it must run faster than the fastest lion or it'll be killed. Every morning a lion wakes up. It knows it must outrun the slowest gazelle or it'll starve to death. So for all of us in healthcare, it doesn't matter whether you're a lion or a gazelle. When the sun comes up, you'd better be running. And that really says it all, because it really, there's so many costs in healthcare, and there's so many opportunities to improve the way it's managed, and it'll happen with collaboration, but it also, it needs a certain urgency and immediacy to make it happen. So with that, I'd be happy to open up for questions.